The London programme investigates whether the capital is becoming an AIDS magnet.
The AIDS virus from sharing needles.
I know a lot of people that were in the scene with me that just disappeared. When I came down to London, I bumped into them.
In this hospital, 3 out of 4 infected addicts come from outside the capital. Is London importing a new AIDS crisis? And inside this central London cafe, Stan Berniot and Dominic Flanagan are just starting work. Their job is to hand out needles to drug addicts.
Just come in.
Yeah, I know. Yeah, I think so. All right. All right. You guys from the caravan, yeah?
Yeah,
Yeah. Hey. Looking for some clean works.
Offering free needles or works may seem an encouragement to further drug abuse. But London's addicts face a far more dangerous problem than their drug habit, the AIDS virus.
Do you know about the risks of sharing? What are the risks, you know?
Well, I mean, the most obvious one that most people ask us about now is HIV, the AIDS virus.
It's, you know, we have to.
The point is that now you can't afford to carry on sharing. We better go outside. We don't normally do it in cafes, you know.
Tonight, we're filming Stan and Dominic with an actor. But this, in fact, is the kind of conversation they have every day. They're paid by St Mary's Hospital in Paddington to hand out needles in an attempt to slow the spread of the AIDS virus. Each week, they hand out needles to a total of about 50 people. But the signs are that efforts on this scale will be overwhelmed by a new AIDS threat. That threat comes from abroad, from cities like Dublin, where the virus has infected thousands of drug abusers.
People can't survive, so they have to go to London. I mean, on the labour in London, they could support the habit, or, you know, they could support the habit and probably not die so quick. It's very hard to survive over here, so they're all heading to London. Most junkies now are heading to London.
The next wave of AIDS victims in Britain will be drug abusers who share dirty needles. And the wave after that will be their sexual partners. And AIDS will have found its way from being a gay disease to becoming a heterosexual plague. London, of course, has its own share of drug addicts and its own AIDS problem. But we've discovered that the capital faces a new AIDS threat. Hundreds of drug addicts with the AIDS virus are flocking to London. In some of the city's drug clinics, the majority of patients with the AIDS virus are not from the southeast at all. They come from Ireland, Scotland, and Europe. We've been finding out why they come to this city and whether there's any way to stem that deadly import. "29-year-old Grant is from Edinburgh. He's an ex-drug abuser who caught the AIDS virus through using dirty needles. Edinburgh has become unpleasant for its many infected addicts.
I didn't know how to face it. It was a very much a topic. I mean, every pub I went into, every time I sat down with somebody, the subject would come up, and I couldn't deal with it, you know. I just wanted to escape for the whole thing, and I sort of got on a train one day, just off the spur of the moment, and I came down to London.
Grant found a squat in the Elephant and Castle and was soon back to using drugs and sharing needles with others as irresponsible as he was.
I was making up my hit, right, and a guy came over and said to me, like, give us a shot of that after you know. I gave the guy the set of works, you know, and he cleaned them out with the water, right, and like, I knew the guy, and I already said to him previously, he just used them, and that was that, you know. And sometimes, like, all the works used to be kept in a tin, right? All the syringes and things. And I mean, I didn't know which ones were mine and which ones weren't. And neither did anybody else. You used to just pick a set out and use them, you know? As simple as that.
Among the drug users who hang around the West End, sharing needles is not unusual. Grant has kicked his own drug habit and now works with addicts to prevent the spread of the AIDS virus. But on visits to Edinburgh, he finds that Scottish addicts with the virus are still moving to London.
I know a lot of people that were in the scene with me that just disappeared. And like when I've came down to London and maybe walked through the West End, I bumped into them and they're down here sort of doing the same thing that I did when I came down, just to get away from it all.
Geraldine Malidi is a clinical psychologist who works with drug addicts. Her research here at St Mary's Hospital in Paddington has revealed that Grant and others like him are part of a worrying new trend. And the influx of HIV carriers isn't just from Scotland. She's been monitoring the level of HIV infection among her clients. At the end of 1986, 18% of those tested were HIV positive. But in just over a year, the figure has risen dramatically to 32%. And 3/4 of these come from outside London.
When we analysed the number of people who were positive, we found that 44% of the sample came from Dublin recently. 22% of people came from Scotland, various cities in Scotland. Another 25% were people who were from London, who were known to us at this clinic, and the rest were people from other European countries. So we were quite surprised by the high proportion of drug users that we had who were from Dublin.
Part of the reason St Mary's sees so many Irish addicts is because its catchment area includes Kilburn, traditionally a centre for Irish settlement. But clinics and agencies in other parts of London have told us that they too are seeing drug users coming from outside the capital. Mary Burgess works at the Alexandra Clinic in Camberwell, South London. Many of her patients are drug addicts infected with the AIDS virus.
About 40% of the drug users that we see who are carrying the virus come from outside of London, in particular Scotland, Southern Ireland, and also from outside, from Europe, from Italy.
The consequences for London's health services are considerable. The majority of infected addicts now attending clinics are likely to develop AIDS in the next 4 years. St Mary's alone has 50 such cases on its books, and we've been told that there could be hundreds more who don't come to the clinic. Dr. Deirdre Cunningham, head of community medicine at the hospital, fears that an increasing proportion of their limited number of hospital beds will be occupied by AIDS patients.
We estimated in September 1987 that if we carried on treating patients in the way that we were treating them, we would require 592 beds for patients with AIDS by the year 1992. This is in fact 42 more beds than our planning agreement with regions says that this district will have for all acute inpatients.
Worse still, the influx of drug abusers could be a catalyst for the spread of infection among the capital's addicts. David Turner is the director of the Standing Conference on Drug Abuse.
When people come into London who are already infected by HIV, they are not likely to be able to get into a drug treatment centre straight away. There may be a waiting list, or there may be not room for them. They're going to therefore use black market drugs. They're going to use other people's needles and syringes, and therefore they're going to see the spread of infection increasing.
Crucially, drug abusers are thought to be the likely bridge that will take AIDS into the heterosexual population. Joanne, an ex-drug user who is herself HIV positive, runs a group for others in the same position as her, called Positively Women. From her experience, there are already signs that the bridge is being crossed.
When I first started the group, it seemed to be that it was more ex-drug addicts at the group, but actually we're now in the minority, and the women that are coming to the group now mostly have caught it through sex. These women have never taken drugs, and this was usually just maybe one night, you know, they'd met a man, gone to bed with him, and he's ended up being positive. I mean, I just think it's going to keep spreading. It's quite frightening. I mean, I don't know what kind of end there will be to AIDS. I see Edinburgh and just how many people up there have been infected, and it'll happen the same in London. I think what people have got to start realising is that it's not just drug addicts and it's not just homosexuals.
The River Liffey and its port Dublin aren't immediately associated with drugs in the British mind, yet the city's 500,000 inhabitants do face a serious problem. From what we've seen in London's drug clinics, many of those with the AIDS virus have come from abroad, a great proportion of them from Ireland. To find out why, we've come here to Sean McDermott Street flats in Dublin. In the past 7 years, this area's seen a rapid rise in drug use, especially of heroin. And behind that rise has been a frightening epidemic of HIV positive. To find out why drug abuse is so prevalent, I spoke to local community worker Paddy Malone. This is an area of poverty and deprivation. Unemployment runs at 70% and hard drugs have found a ready market.
You would find used syringes, or you would find vomit on the stairs or on the balcony, and you would have people knocking on your door for bottles of water after they have had a turn on. From 15 to about 20 years of age, you're talking about 35% of the people who actually live in, this community, were actually abusing heroin.
Other areas of Dublin have been affected just as badly. The city now has an estimated 6,000 drug users, and the practice of reusing needles has spread the virus rapidly. Did they share needles?
Yes, in a very big way. People, to my knowledge, never actually shot up on their own. They always done it as a group.
The result has been a devastating spread of the AIDS infection. Paddy Malone estimates that out of every 100 young adults, 8 or 9 are HIV positive. But Dublin is a hostile place to be if you have the AIDS virus.
Because of the stigma that people actually feel here. What you're talking about is a very close-knit, community, where if, somebody roars on the balcony, the one around the corner knows who it was that roared. So when you've got somebody who has been diagnosed, he or she feels, Jesus, this whole block of flats knows about me.
In Dublin, addicts are strongly pursued by the law, and they have a particular reason to keep out of the hands of the Irish police, because here, imprisonment also means segregation. Infected addict Larry Kinlan spent time in Dublin's Mountjoy prison.
Now it is, when you go to prison now, you're segregated. You have a place in Mountjoy now, the security wing. It was really for hardened criminals, rapists, murderers, psychopaths. Now they have all the AIDS virus people over there. You're segregated. So that means when you go to prison, you're put out there. People know you have the virus because your family's going to separate, you go separate places to visit you. And it's terrible, it's bad enough going to prison without being segregated.
Finally, those seeking help find that little is available. Mara de Lacy works in the Anna Liffey Project, the only drop-in counselling centre for addicts in Ireland.
There's only 2 residential facilities available, and these facilities have definite policies now on injecting drug users, basically based on the HIV situation. And as a result, because the bulk of the drug users within the Greater Dublin area are injecting drug users, it has left them with the choice of one agency, one residential agency that they can attend, or us.
Donna is an HIV-infected addict who's been through the system.
You have to go through an awful lot of hassle. You nearly have to get down your hands and knees to beg for your methadone. And once you've been through one course and have gone back on drugs again, it's even twice as hard the next time. And most addicts go through an awful lot of detoxes, and a lot of them will never ever get off. But that's just the way they look at it. And then the treatment centres here wouldn't take me because I was HIV.
With little chance of treatment and caught between the fear of imprisonment and the need for drugs, many addicts look to the ferry to London for a way out of their problems. Over 30,000 young Irish people leave for London every year, looking for work and a taste of big city life. For drug addicts among them, there are extra attractions. London offers anonymity. Drugs and drug substitutes are more easily available, and for those with the AIDS virus, there's a chance of medical treatment. Rosie Smith has worked with many young drug addicts and their families. How typically would a young person that you're dealing with get this idea about things being better in London?
Yes, that's an impression that the people that have gone always write back or come back and say things are terrific, you know, I'm getting on very well, things are very good. And then maybe 2 more would go.
Well, I was told it's much better than London. It's much quicker to get maintenance. You know, and it's much easier, and it's much easier to live. You know, it's cheaper and there is work. There's nothing over here.
Mary Roach's children went to London, but she can't persuade them to come home. How many of your children are on drugs?
Well, I have 6 children, but as far as I know, there's 3 on them.
So half of your children are using heroin?
That's right.
2 of your sons have gone to London?
That's right.
What do you know about their
Well, I don't
leaving?
really know. They don't write, they don't send letters. Only what I hear from other people that go over to see them.
This is the 8:45 ferry from Dublin to Holyhead. For many of this city's drug addicts, it represents an escape route from official indifference, social stigma, and a lack of treatment. In less than 12 hours, they can be in central London, and there they'll find anonymity, cheap drugs, and if they want it, free treatment for their drug habit. For many of them here, the lure of London is irresistible. This exodus greatly concerns people like Christy Cleary. He's a voluntary worker for Cardia, a support group for people with AIDS and the AIDS virus. He's come to the capital to investigate the problem further.
I think it's everyone's responsibility here in Ireland, the government's responsibility, to investigate why people are leaving this country and why they're going to London and what is the missing factor here that's making them go. And I think we should be building up contacts with different groups in London to find out like how our people are being treated in London.
He especially wanted to meet John Mordaunt, who knows the situation at first hand. He caught the virus in Dublin while he was an addict sharing needles and has since gone on to develop AIDS-related illness. John came to London because he wanted to get into a methadone maintenance program to help him come off drugs. Christy has been trying to find out why people like John leave and why they won't come back to Dublin.
I mean, the major reasons why I came to London was because of the type of treatment I received in Dublin, which was just horrendous. You know, I spent 6 weeks locked up in a room in a hospital where nobody who came into the room didn't wear a spacesuit. For me to go home, the attitude would have to change. I would have to be able to walk down O'Connell Street in Dublin and feel that nobody was going to say, there goes John who's got AIDS. You know, I wouldn't like...
You feel that that's what would happen?
Well, yeah, I mean, when I went public in Dublin, there was a big, you know, brouhaha all about it, you know. Here's a person finally admitting that AIDS affects heterosexual men and women as well as just gay men, you know, and I am an addict, and I could suffer a lot in Dublin from people's preconceptions and their attitudes.
There's no prospect of people like John Mordaunt or Donna or Mrs. Roach's sons being put off coming to London as long as attitudes in Dublin remain the same and as long as they can find some help here. And once they found homes in the capital, it's unlikely that we could refuse assistance to AIDS-infected addicts. Yet the more drug abusers arrive in the capital, the more Londoners are at risk. So what can we do? On the face of it, the best solution is to encourage the addicts not to leave their homes in the first place. We asked the Irish government to comment on the problem. What they had to say wasn't very encouraging. They told us that while policy in relation to segregation is regularly reviewed, there are no plans for any change at present. That the drug treatment services available here are sufficient to cope with demand, and that it is not the policy of the Irish government to restrict the entry into this country or exit from it of HIV-positive individuals. So if Ireland is unprepared to do anything about the outflow from Dublin, does the British government intend to do anything about the addicts from Scotland? We asked the Minister of Education and Health for Scotland, Michael Forsyth.
One of the reasons that drug misusers do leave Scotland to go south to London is because there is a more readily available supply of drugs on the streets in London, and in a sense the success of the police and customs authorities in Scotland has perhaps resulted in that drift south.
Some of the evidence that we've gathered suggests that the reason that people are coming to London isn't really to do with supply of drugs, but is actually to do with supply of services for those who are HIV positive. Now that suggests that there's something missing in Scotland.
Well, I'd be interested to see the evidence, because far from there being something missing in Scotland in terms of support services for people who are HIV, we are very much ahead of the position in terms of numbers of cases. We have very small numbers indeed of people who are HIV positive and who've developed full-blown AIDS. But
maybe because they've all gone off to London.
Well, on the contrary, we have established in our 3 major cities facilities which are dedicated to the provision of treatment for people who are suffering from AIDS, and the extent of those facilities exceeds the available demand.
On the face of it, both the Irish government and the Scottish office seem content to leave London to find a solution by itself. One approach might be to try to prevent AIDS-infected drug users from entering the capital in the first place. Margaret Jay has examined this idea.
There are major problems about trying to stop people moving about this country, major problems about threats to civil liberties. And on top of that, there are the extra additional problems about testing people for the HIV virus, because people need not show up as being infected until several months after they originally have been. No test for antibodies is positive for several weeks or several months after people are infected. So you're talking about using enormous resources for continuous testing, a great deal of money, and really wasting a lot of time.
Well, Michael, the results of your blood tests have come through, and we have found antibodies that indicate that you are HIV positive.
For its part, the government has gone in for health education.
The AIDS virus can live on dirty needles and equipment, so don't share.
But experts believe that the campaign has a limited effect amongst those most at risk, the already injecting drug user. If they can't get needles, whatever the risk, they'll share. The Bloomsbury Health Authority is adopting yet another approach. That's minimising the AIDS risk to addicts by offering them clean needles. One of London's most successful needle exchanges is run for the authority by Nicola Woodward. They see more than 50 addicts a day here to offer them clean needles and persuade them never to share.
How did you hear about us?
Well, mainly from people around the West End. And from,
But to benefit from needle exchanges, you both need to know about them and to trust the organisers. The Scottish and Irish newcomers are unlikely to have either the knowledge or the confidence. Drug workers like Nicola Woodward accept that to reach many of these people, they need to get out onto the streets.
Given that there are people coming to London who are coming from areas that are known to have a high incidence of HIV infection amongst intravenous drug users, it's now important more than ever that we start targeting those groups. And if we're going to get in contact with these people, we can't wait for them to come to us. We need to get out onto the streets and directly make contact with people ourselves.
To date, Stan Berniat and Dominic Flanagan work for the only London-based organisation handing out needles on the street. Some other health authorities have expressed interest, but fear of provoking a public outcry by appearing to encourage drug abuse means that all authorities are moving slowly. That lack of urgency may turn out to be fatal.
Curbing the spread of HIV infection amongst drug users is a race against time, and it's crucial that we win that race. Because drug users are sexually active, and if we don't curb the spread of infection amongst that group of people, then they are a bridge for the spread of infection amongst the whole of the population. If we don't win that race, then infection is going to directly affect you and me and all of us.